Okay, this is a get out of jail free card. And many people want this card. The thing about it is, even if you do jump through all the hoops and get your paperwork in time and do all the work that you have to do for Health Canada and the MMAR, even then, it may not keep you out of jail. Unfortunately, the police are not educated on this program. They don't know how the laws are around it. There's many reasons for that. But the main reason for it right now is that there are several cases going in front of the Supreme Court, and they're basically going to bring down the pot laws. So in the meantime, everything's up in the air. And so the police don't really know how to proceed. So basically they just proceed with the way that they've been taught to go along with anything to do with marijuana. They'll prosecute first, or drag you down and arrest you first and ask questions later. That just seems to be the way things go. Since there's only 5,000 people in all of Canada, we're such a small minority, and I can understand why the police have not been trained on this. I'm more than willing to be one of the people. I'll put my hand up. Yes, I'll be the one to stand up in front of the police and teach them the laws as soon as the Supreme Court has figured out exactly what the laws are. But I'd be willing to do that. But somebody has to, because I've heard stories and talked to people, cancer patients being dragged off to jail who have their card. It just doesn't make any sense. It's a waste of resources. It's a waste of everybody's time, and for them to have to go through all the problems to get the card and still be dragged off to jail, it just frustrates me to no end. The other issue is there's even just one group of people that would be so helped, epileptics. They're one group that has not been allowed on to the scheduling. People have said that they would like to try it, and people who have epilepsy who have tried cannabis have had no signs of their epilepsy. So there's approximately in Canada somewhere around 400,000 epileptics. None of them are allowed on the system. I don't know how many cancer patients out there, HIV patients, asthma patients, diabetics. I mean, this medicine is good for everybody. It can help so many things. But the fact that only 5,000 people have managed to get on this program after 10 years is just solid proof that the MMAR does not work. It's almost like it was made to fail. And the failure is at the point of finding doctors who are willing to sign for you, and at the point of the police, where those are the two ends of the deal. If you can get through the hassle of finding the doctor and get it signed, then you have to kind of be in fear all the time, as long as the police officers have not been updated as to what the program is about. So after finding out that jumped through all the hoops to get the card, you find out that the police have not been properly informed. It's difficult to get through your life and have that feeling of fear on a constant basis that you could be arrested, because the police officers just simply have not had the time and effort to be educated on this particular program. So few people have been on the program, so I can understand why the police have not had that opportunity. But there's so many things that could easily be helped or treated. Cancer patients, definitely. We have lymphoma patients who have been cured with the oil. There are people who have diabetes that have managed to get off insulin and just go to a maintenance dose, pills. There have been people who have had basically gotten off their deathbed after having chemotherapy and being treated for that. It's great for peripheral neuropathy. There's just so many. I can't list them all. It would take hours actually to go through the whole list. But essentially, all these people could be helped, and there's only 5,000 people in all of Canada. 33 million people? The potential is huge that so many could be used and only 5,000 have been treated. So it's obvious that the MMAR regulations have not worked. And they're not going to work the way they're set up. There's just too many problems with it. The fact that the entire regulations and the drug laws are going to be falling is a bonus for us to be able to help raise awareness and change the law so it's healthier and better for all concerned. Turn it into a health issue, not a criminal issue. On the health issue side, doctors have not been properly trained. They're afraid to sign off on this because their lawyers are saying, well, what happens if the person happens to get some marijuana that has some spores in it and they have emphysema or something go wrong with it. A lot of that's hypothetical. Marijuana is safe. No one has ever died from it. Even spores and stuff, the lawyers are just basically making the doctors afraid. And I can understand that point too, but they need to get in line and understand that this is going to be the new medicine. This is the new aspirin of the 21st century. And if they don't get it, they're going to be left behind.